because this is a ultrasound study of a 70 years old female presented with the complaint of dysuria and urinary urgency plus vaginal discharge that does not smell and is not blood stained for the last 2 weeks. And on ultrasound what we see is that this is the urinary bladder in longitudinal section. Urinary bladder in longitudinal section. This is the uterus, and this is the vagina. This line, you are seeing the maximum I can get through transabdominal ultrasound using 3.5 megahertz probe. This is the vagina, cervix, vagina, cervix. No mass related to the cervix. This is a postmenopausal uterus. As you can see, there are multiple tiny calcified areas seen related to the myometrium, which is thinned out, and the whole of the endometrial cavity is seen filled with echogenic material, different strength echogenic material, as well as multiple tiny calcifications are seen within it. The uterus measures 9.5 centimeters by 4.2 centimeters, and this is a uterus which is full of internal echoes along with few internal calcifications. These arrows are indicative of calcifications, and it is filled with different strengths internal echoes. All of the myometrium is thinned out. We don't see the at the anterior myometrium is thinned out. Posterior seems to be a bit retained. This one, posterior myometrium, shows some echogenicity, is normal for the parenchyma of the uterus myometrium. This is the ovary, which measures 3.0 by 1.8 centimeter, and seeing the ovary the size in this age is also not normal. They are usually atrophic at this age. See that there are few cystic areas. There are few cystic areas along the myometrium. 1, 2, 3, 4, 5, 6, 7, and this calcification is suggestive of old age, postmenopausal calcification, and the rest, all of it is full of different strength internal echoes, and the endometrial canal is dilated up to 3.5 centimeters, which is abnormal. Okay, now having seen this, this was a study of the uterus. Next, I'm going to magnify further. Now, these calcifications in this region is that of postmenopausal calcifications, old age. This is these calcified areas, tiny, multiple, within the different strengths internal echoes, within the myometrium, within the endometrial canal, echo-filled endometrial canal. These are tiny calcifications. So this was a longitudinal study of this patient's uterus, and now let's go to give a 90-degree sweep to the probe and see the uterus in transverse section. This is the transverse section, and you can see that the endometrial canal is dilated. This is the endometrial canal. It is full of different strength internal echoes, and these echogenic areas without any shadowing in the myometrium are the calcified areas which are normal for the age of the patient, as this is a postmenopausal age uterus, age 70 years, patient age is 70 years. So postmenopausal uterus shows calcifications in the myometrium. So multiple calcifications are seen in the myometrium, which is thinned out, and the endometrial canal is full of different strength internal echoes, as having internal calcifications as well, tiny internal calcifications. Now as I move the probe towards the left adnexa, I see a complex mass. You see, this is the mass at the region of the left adnexa, having cystic and solid component within it. This is the cystic part, and this is the solid part within the mass. So mass has cystic and solid elements in the region of the right adnexa, and it measures approximately, this mass measures approximately 7.1 centimeter by 6.0 centimeters. This is a complex mass, cystic and solid. Even the solid area, this region, is showing heterogeneous appearance, inhomogeneous, with echogenic areas. However, hypoechoic areas are seen interspersed within the echogenic area. So this is a complex mass. This is another cystic area within this mass. This is a tiny calcification. This is a tiny calcification within the mass. So multiple cystic areas are seen. Now you see here, the cystic areas are seen within this solid echogenic mass. Why solid? The reason being that now this is the transverse section. This is the longitudinal section. Now the question is why we see posterior wall and acoustic enhancement from this solid mass. The answer is, it is because of the multiple cystic areas seen within the solid mass in the region of the right, complex mass in the region of the right adnexa, because of which the posterior wall is seen showing increased acoustic enhancement. It's because of the cysts within this multiple cystic areas of variable size within this complex mass. Here, no fluid is seen in the pelvic cavity. Now you see that this is the uterus. And this is the mass. This is the mass, solid, complex, with tiny internal calcifications and multiple cystic areas within it. In the region of the right adnexa, we do not see any anomaly. However, we do see an ovary, which is this one. This area is the ovary, right ovary. This is again a review of the uterus. This is the uterus. This is the myometrium, in which you are seeing echogenic particles postpartum. Post menopausal. This is the different strength eco-filled endometrial canal. The myometrium is thinned out. This is the cervix, no mass. This is the vagina. These are the tiny calcifications seen within the hose. This is the right ovary. This is the urinary bladder, which is approximately 8.6 centimeters by 3.95 centimeters. This is the transfer section. Of the uterus, showing myometrial echogenicities of postmenopausal uterus, eco-filled endometrial canal, that is dilated up to approximately 33.5 centimeters, and a complex solid mass in the region of the right adnexa, extending up to the right lower abdominal quadrant, that measures the measurement of this mass is approximately 8.6 centimeters by 5.7 centimeters with cystic and solid components and internal calcification. So there is no mass effect, as both kidneys are seen normal, and there is no fluid in the pelvic cavity in this case. So this is the case of the day. Thank you.